Welcome to the Salmon Runs YouTube. Enjoy the video.
You begin by choosing the right dental thread for your spacing, waxed for tight contacts, tape for wide gaps. Once done, wash your hands and cut 18-24 inches of thread, then wind most of it on one middle finger and the rest on the other to maintain tension. Make sure to hold the thread taut between thumbs and forefingers. Start at a back tooth, gently guide the thread in with a slow sawing motion until it passes between teeth. Don't force it or snap. You now focus on the C-shape technique to clean the sides of each tooth, curve the thread around one tooth, then press gently to the gum line to remove subgingival plaque. Make sure to slide the floss up and down 6-8 times on each surface, covering from gum line to the biting edge. Once that contact is done, unwind fresh thread from your fingers so you don't spread debris. Take your time in tight areas. Small controlled strokes work better than wide aggressive motions. You finish by rinsing and checking your cleaned areas for any remaining debris and mild bleeding, which can be normal the first few times. Once done, dispose of used thread and floss your next quadrant the same way. If thread shreds or snagged, make sure to switch to a PTFE or dental tape design and reevaluate technique. Gentler insertion and different angle often fixes it. If bleeding persists beyond 1 to 2 weeks, make sure to see a dentist or hygienist for assessment and guidance.
Thanks for watching. Consider subscribing if we helped you.